So just really quick, as Geneva's doing that, if everyone can put themselves on mute, please.
Okay. So if you have any questions, feel free to put them in the chat box, and then my lovely assistants will sort of help me see them. And if you have any questions along the way, feel free to just kind of unmute and let me know. This is intended to be interactive, and there will be some portions where I am going to ask for some feedback from you, and we'll do some practice on some things. So just be ready for that. So today we're going to talk a little bit about community engagement and outreach. So really important steps in project development and project implementation. So let's just kind of define what that is. CDC says community engagement is the process of working collaboratively with and through groups of people affiliated by geographic proximity, special interest, or similar situations to address issues affecting their well-being of those people. So let's kind of break that down a little bit. So working collaboratively. So looking at these two photos, do you notice anything different? And this is the first feedback that I'm going to ask for. So if you have any, what do you notice about these two photos?
From what I can see, the guy on the chair with the blue is not taking in input from everybody else. He's just giving out input.
Yeah.
We have a couple in the chat box that there's interaction with the ground group, and also one person is talking.
Yeah, exactly. So in this situation, is somebody that's sort of just telling people what's going on. It looks like that guy is sort of like standing above everybody else and kind of giving directives, and it's not really a dialogue or a conversation. Whereas in this other group, you have multiple conversations going on. Everybody's sort of on the same level, seated at the table, and able to add input. So when we think about our community engagement and working collaboratively with people, making sure, and obviously sometimes you need to take some leadership role in facilitating those conversations or organizing those meetings, but ensuring that the people that you're inviting to those has a equal voice in that, and is able to contribute to the way that your project goes. And that could be a variety of people, and we'll talk a little bit about who those people might be. So the next part is with and through groups of people. So with and through groups of people associated by geographic proximity, so special interest or similar situation. I think oftentimes when we define community, we automatically go to a geographic location, which is totally fine, but just also knowing that there's other ways to define community. So community could be a geographic region, so maybe it's your entire tribal community that you're planning on working collaboratively with and engaging. But it could also be special interest. So maybe there's people in your community that are really interested in cultural revitalization, and that's what your project focuses, and so that's who you might be reaching out to. Or perhaps it's some people in the healthcare field or doing medical and clinical services. And so you would make sure that you invite those players. It could also be similar situations. So maybe it's like this, all these photos kind of do age groups. So we have our women, we have our men, we have some of our elders, we have healthcare workers, youth, and young children, right? So those age is a similar situation. Maybe everyone living with diabetes could be a similar situation. Maybe it's your youth or those who have substance abuse issues is your special situation or similar situation. So when you're thinking about community engagement, a really important step is defining that community. So what is your community? It doesn't necessarily have to be your entire town. It can be who is that target population that you're wanting to meet the needs of. And so that's going to differ. Maybe it's your workplace community. Maybe it's just your tribal administration community. Maybe it's like the political leaders. So there's a bunch of different ways that you can define it. So just knowing that it's not just one geographic location, but you can really actually distill that down to more specific groups of people, depending on what your project focuses. So then the final piece of this definition is to address the issues affecting the well-being of those people. So again, these are all kind of images of the areas that we are focusing on. So we have nutrition, we have commercial tobacco and traditional practices. There's an elder reading to some youth, so there's some intergenerational stuff going on. There's the medical yoga that's actually at Matheson on a site visit a couple years ago. And then stuff that's going on within our health clinics on clinical community linkages. So once you've defined what that group of people or community of people that you're working with is identifying what is that topic or the need that you're trying to address with your program. And again, once you define those, that will sort of help you understand who are those people that you need to invite to the table, who are those leaders, the decision makers, who are their participants. So if you're trying to work with youth, maybe it's also important that you're reaching out to their parents because they might have a big influence on how they participate or not in a program, or with their school teachers. So just thinking about what is the need that you're trying to address, who is that going to be, whose need is that, and then how are you going to engage those folks? So just some general tips for community engagement. I think the biggest and most important one is identify who you are engaging and why, and that kind of goes back to that definition. I think it's really easy sometimes to say, oh, we're doing it for an entire community, or we're actually, but really your program is focused for youth. And so if you're saying that you're going to do it for your entire community, but your focus is at youth, you might actually miss some people, or you might not design your program or implement your program in the best possible way or the most effective way because you're not tailoring it to that specific population or for that specific need. So I think this is really important in your planning to identify specifically that target population, and you guys put those in on your work plan, but just thinking about that more in depth of who is it that we really want to reach. And then the next one is building trust and relationships. So that kind of means knowing your community and recognizing and respecting those community cultures. So again, we're not necessarily talking about geographic community. So maybe I'm going to use this youth example. Knowing the youth community. Maybe you don't have a strong connection to the youth, but there is another adult that does a lot of work with the youth. And so maybe you're showing up to some of those events and you're sort of building relationship, or you're drawing in that adult or some of those youth leaders to be in that conversation. So you can get to know the community and they can get to know you, and they'll be more responsive to what you're bringing to the table. And then recognizing and respecting community cultures. Off the bat, this can, be associated with traditional cultural practices, but there's also community cultures like within a workplace. So what is the culture of the workplace, and what are the norms there, and what's the style of communication, or how do people get their information, or where do they hang out? So there's a whole bunch of cultural nuances that can be, cultural, traditional, respecting that piece, and also the pieces of just like that social cultural environment, or even that environment, the physical environment. And so as you get to know those communities and understand sort of how they work and what are their values, helps you be more able to focus and tailor your program to meet those needs and have them be responsive. And then a final tip is draw on the existing community systems and strengths. I think oftentimes when we design programs, we look at that program as an isolated thing. It's like, we're going to implement this program into the community, and oftentimes we don't really think about what else is already existing in the community. Is this doubling up on something that we've already been doing? Or can this actually come up and supplement something that already exists? Or if there is a really strong youth program, is there a way to get our programming into those events as opposed to creating a whole separate event for the youth to show up to? So there's a lot of really great things going on within an organization, within a geographic community, within subgroups of those communities, and ways that they already operate. So instead of coming in and sort of designing this whole new system, how can we just take that funding and sort of weave it in to the existing systems and strengths that community has? And then just knowing that partnering is really necessary to create change and improve health. It's really hard for any program to be sustainable and long lasting if it just tries to exist as an isolated program by itself. You know, it's like work smarter, not harder, or don't reinvent the wheel. You know, those are all sort of statements that kind of support the idea that it's really important to integrate and partner with different people so that your programs can be the most successful. And then again, the second one kind of speaks to that as well, is sustainability results from mobilizing community assets and developing capacities and resources. So maybe there's a youth leader that has really great relationships with those youth, but he's not really trained to facilitate the programming that you want to incorporate. So instead of hiring somebody outside that doesn't have that relationship, could you train him so that he's building his own capacity and he can keep that relationship and still give you, like, deliver the information. So just knowing, you know, building up what's already existing instead of starting from scratch. So community engagement, so you can kind of assess yourself a little bit with how well you're doing with community engagement, and there's a couple of questions you can ask yourself. So are the right community members at the table? I want to just kind of maybe speaking to Greenville, right? So they're trying to improve their workplace community and culture by improving team-based care. So they drew in all of the important leaders and representatives to sit at the same table so that they can talk and have a dialogue and make decisions that way. Now, if it was just Jen and maybe Lucretia, the executive director, they probably wouldn't be able to get to the same place that they are now just with the two of them. So making sure that you're inviting all the necessary people to that table, and then are their voices able to be heard and equally valued? So if you are, for example, maybe you're bringing an elder or a youth community member or maybe a parent to do a youth-focused program, you know, are the program leaders or the like tribal council or, you know, like the leaders, are they getting more voice? And are we actually kind of hearing all the people that maybe the programs would be impacting, like the parents or the youth? Because we know that there's a lot of really great kind of collective intelligence within our communities and experience and knowledge, even in our youth, in our elders, in our adults, in our community members, and people that are working in the professional world, and those who are not. So everybody really brings value to that table, and are we making sure that we're equally valuing those voices? And when we do that, that empowers those community members who are going to be the people that are going to spread your program by word of mouth, or they're going to be the ones that are going to decide to take their kids to that program or not, you know? And so if we make everyone feel valued in that, then it can really improve our program quality and participation. And then how are community members involved in developing the program or intervention? So ensuring that they have some input on that. So again, I'm going to keep using this youth example. You know, if parents aren't brought to the table and they're the ones that have to transport their kid, and it's like at this program is at the same time as another program, or it doesn't work with, you know, it conflicts with something else they have going on, but you never invited them to share that information. You might plan the most beautiful, wonderful program, but no one will show up because it's conflicting with a time, or there's no transportation or other things. So I love this Dilbert because I think it's community engagement can be hard. It takes a lot of extra work and it takes a lot of extra planning. And it can be really hard to get everybody in the same room at the same time. So just know that going into it, it's not going to be perfect. But I think that making that effort and at least putting out the attempt will be better than doing nothing. And so this Dilbert just says, before I make a decision, I'd like to ask for your opinions. And it's supposed to make you feel engaged. And it's like, are you actually going to listen to us? And he's like, well, I'm hoping it looks that way from the outside. So, you know, it's like how knowing where our heart is in these conversations, are we actually genuinely interested in hearing the input of these other folks, or are we just kind of trying to do it to check off a box? And people feel that, right? And so just kind of making sure that your heart is in that and you're really wanting to bring those folks to the table. Does anyone have questions about any of this so far, or comments? I know sometimes I can get to motor mouth, so. Okay, so community engagement really happens all throughout our projects. So it's not just during the planning phase. So in the planning phase, you're going to come and we want to identify the needs and the approach. So they're going to help you define what that program will look like or what that project will look like. That's when you sort of assess what existing resources and systems are in the community. And then on implementation, they're going to help you carry out project activities. They're going to be the ones that are going to get you into that youth program. They're going to be the ones that are participating in your program. And so engaging them and continuously engaging them throughout that process. And then on the evaluation, you're going to gain their feedback to understand the project impact. So how did that process go? Were people in attendance? What could have been done differently? What worked really well? And so using all of, again, those voices to make sure that it helps guide your program. And then again, once you start that process again. So it's kind of a cycle where you're planning, implementing, evaluating, and then you're planning based off that evaluation, planning, implementing, evaluating. And we're obviously here in implementation. So knowing that there's still ways to engage your community. Maybe we didn't do it the best in the beginning, but how can we continue that process now, or start it up now, or even set up systems so that when you do start another project, it's kind of in place. So I think sometimes, I don't know if you're familiar with Field of Dreams, but they say, if you build it, they will come. Well, that's not necessarily true. It's more like, if you build it, will they come? So it's kind of that idea again of, you might build the best program ever, or have the best nutrition class or the best physical activity class or wellness program, but no one's showing up to it. So that can usually be a sign of maybe not having the best community engagement or outreach. So outreach, ideally would have had people in that planning phase, but if they're not showing up, like, you need to sort of reassess and figure out why. So that kind of falls back on you as project leads and staff, is what are we doing that is not getting it to the people? How are we, what can we change to reduce the barriers and get people to show up? So outreach is an activity of providing services to any populations who might not otherwise have access to those services. A key component of outreach is that the groups providing it are not stationary, but mobile. In other words, they are meeting those in need of outreach services at the locations where those in need are. So this can very literally mean like a mobile health clinic where you're bringing services to people, or your community health representatives that are literally going to people's houses to bring them the services that they need. It can also mean tailoring your project to be at the level that your community needs. So meeting them where they're at with their resources, with the education, with their income, with their transportation. So all of those things, kind of, how can you meet the needs of the people that you're trying to serve? Oftentimes I think and I see this in healthcare systems where it's really designed to meet the needs of the provider or the people that are in management or the project staff, what's convenient for them. When really the ultimate goal is we want to try to support the needs of our community members. So how can we do our due diligence to really bring our work and services to them? So some questions for outreach, and this is sort of when you're in your planning and implementation and evaluation phase. So things to ask yourself again about that defined target population or that defined community is, who are you trying to reach? What are the best ways to reach and serve your users? And are there any gaps in use of your program or service? And why do you want to ask these? Because you don't want to run a program where your community members or your target population don't even know that the program or service exists. And thinking about your ACRONs projects, do your tribal council know that your program exists and what it does? Does your community at large know that you have this funding and what you're doing with it? And how it's going? Or does your boss, so just knowing that the people that you're trying to reach, do they even know that that works or that it's there? And then are they willing to use it? So is it meeting them at a level that they can use it, or does it feel relevant to them, or is it culturally tailored to them, or is it in a location that they can do it? And then being capable of using it. So is it accessible? So maybe I do want to show up, but I don't have the ability to show up. It's at a wrong time. I can't attend it. or maybe it's, you know, at a level that's above mine. So just figuring out, you know, how can you sort of tweak each of your programs in order to reach that target population, which is, you know, kind of going back, it's like target population can be very easy to be like, oh, community members, 150 of them, you know, but if we really want to be effective with our programs, how can we really identify that population and really target our outreach and our engagement with them? Any questions on that? Just feel free to shout it out and pause me if you need to. Okay, so what are some considerations for how we do our outreach? So this is, you know, say you have this program and no one's showing up to it. These are some maybe questions and considerations to ask yourself as to why, and maybe make adjustments as you see fit. So first one is location. Is it at a place that feels safe for the people attending? Can they get to the place that they're going to? Is it comfortable? Is it convenient? You know, so is it, you know, if you're having a thing with youth, you know, it might make sense to do it at the school or somewhere that the youth already hang out. Or if you're doing it with nursing mothers, you know, where do they go and where is the, like, you know, what is a place that they can feel comfortable? Is there breastfeeding places for them to go to if they're, you know, if they're young mothers? So all those little considerations of how to make your folks feel comfortable. Do they have transportation? So I know that that's a big issue for a lot of our communities since we're pretty rural. So is there transportation to get there? This is not on there, but childcare, you know, is there an accessibility for childcare for parents to go? Is it too far? Is there a way to do a carpool? Does public transportation go to that location? And so ensuring that the folks that you want to have attend have a way to get there. So people's ability level and access, as well as age. So, you know, if you are doing something with the elders and the location you chose has a bunch of stairs that go up to it, that might be hard. You know, making sure that your space is, and your offerings are meeting people at an ability level. Maybe you're doing physical activity exercises, and you need to make sure that your offerings are widespread so that it's, you know, not just for young, fit folks, but it has, you know, you can reach people that are elderly or have limited mobility, or people that are just getting into physical activity, or maybe something that's a little bit more gentle. And then you can have your like power cardio, you know, crazy stuff too. And then age, you know, and so like, again, that with like the content of your material, is it for youth? Okay, so is it in language that youth are going to understand? Is it in a way presented in a way that's attractive to those kids? And so just being really mindful of everything that you're putting out there. Who are you trying to reach, and does this match their needs? So another one, is it culturally tailored? So does it align with the values of your community? And does it support those values? You don't want to put out some information that feels challenging to some of the beliefs and values of the people you're trying to serve, because that will automatically create divide. So like Ephraim and I just did our presentation at Lake County, and we want to talk about and tell providers about the difference between cultural traditional tobacco and commercial tobacco. So if a provider comes at a patient that smokes and they say all tobacco is bad, but they actually use it for traditional tobacco, that might create a divide between that patient and the provider, and they might be less likely to listen to what the provider has to say because there's a little bit of offense or, you know, not a sensitivity. And so just making sure in your materials and your messaging is cultural. And again, that doesn't always just have to be like, you know, tribally specific culture. It can be like whatever that organization culture or community culture or age culture. So again, we kind of talked about this a little bit, plain language. It's a really bummer to develop a program and some information and maybe a training package or resources that just are hard to read, or they're just above the level of the people that you're trying to reach. Or in this little image, you can see it's this massive page of writing versus like a little infographic with like quick facts and blurbs, you know, like what are people more likely to read and engage with? So if my ultimate goal is for you to have some nutrition information, I'm not going to give you just like a whole list of, you know, dense text because you probably won't read it, right? I would want to spend a little bit more time and maybe focus on a couple key points that I want you to take away with a couple images, and then you're going to be more likely to actually read it. And that's what we want. So another consideration, time of day, length of program, and other conflicting or relevant events. So again, thinking about your population, might be hard to have a youth program during the day. You know, it might be easier to have young mothers do something during the day. How long is the program? And then looking at your community and what other programs already exist there. Are there, is there ceremony time there, or is there another conference or event that's going on there that's going to take away? I know some people have talked to me about, like, you know, we had everybody signed up, but then it was the playoff game between the two high schools, and so nobody came to the program, you know? So even those like smaller things is like knowing your community, and do you need to reschedule then, you know, because there's no point in showing up if no one, you know, it's like if no one's going to show up. So just catering to the needs of your community so that you can get the most people there. And I think that going back to time of day, is like, that's why community engagement is so important, is you can ask those questions, right? You can ask your community those questions. When does it make sense for us to have this program? How long would make sense for us to have this program? And then the next one is preferred communication methods. So, you know, depending on who it is, maybe those kids love the social media. I know Round Valley has had some success with text reminders to get people to show up for meetings and events. So they do mass text stuff. I don't know if people prefer print or newsletters, or like, you know, hard copy mail, if anybody does radio. So understanding where does your population get most of their information and what is their preferred way to get that information, and then making sure that you're giving it to them in that way. And then finally, just the content. So make it informative, make it entertaining if you can, engaging, so let people interact with you. Maybe throw a joke in there, knock, knock. I'm just kidding. And yeah, and then make sure it's informative. So kind of a lot of considerations, but these are just really common barriers that, like, as a program planner, you have the ability to address these pretty easily. And if you do that and remove some of those barriers, you're going to increase your likelihood that people will participate, or that you can actually get the services and information that you want to the community members that you want it to go to. Okay, so I'm going to stop talking for a little bit and we're going to practice. So I know that all of you have run a lot of programs or have a lot of skill doing some of these things. So I just want to, we're going to read a couple scenarios and then practice kind of going through how we might outreach to them. So one, you're running a summer sports and nutrition program for youth and you're recruiting participants. Last year, only 5 out of 45 eligible youth participated. How would you outreach or plan for this program to increase participation? So you don't have to answer these questions specifically if you want, but these are just some good starting questions for how you would approach that outreach. So who are we trying to reach? What are the best ways to reach and serve our users? And then are there any gaps in the program? So feel free to unmute yourself, type in the chat box. How would you try to kind of address this barrier or maybe increase participation from last year? And I know a lot of you guys are using chat box, so maybe you're trying to type something. Anything?
So we have one in the chat box. I would create an events page on social media for starters.
Great, nice.
I have one more in here, mailing fun flyers, pictures of previous years and good incentives, and then reach by multimedia access.
Nice, yeah. So doing some social media stuff, doing some fun flyers, reflecting on the success of the previous year are all great ideas, and doing some multimedia stuff. So if who we're trying to reach, most likely it's going to be a couple different groups. One would be the youth, obviously, because we want our youth to participate. But who else might be a good consideration?
We have one in the chat box that says Facebook page.
Nice, social media. So definitely with our youth. So we know a lot of our kids are on their phones all the time and using social media all the time. And so that would be a really great way to sort of, if they're on social media, to post your event there, get a couple of kids to like it, maybe share it. If there's some, youth leaders that you have, maybe past participants could share it on their page. So that other kids their age are seeing it recommended by their friends and not just by an adult. That's awesome. And also just knowing what are the social media platforms that are hot these days, right? So Facebook kind of seems like an old person thing now. It's like Snapchat and Instagram are what's new, right? And so is Facebook really the best way if we're doing social media? Maybe we do need to do some snaps or, that cool stuff. So yeah, and I think I love the idea of using successes from previous years to try to see people, have photos of people that they know participating in it, and how that was fun or successful might encourage new people to come. And then, what about the timing? So looking at that feedback from last year, asking those youth or asking some of the community members why they didn't show up. Maybe it had a conflicting event, or maybe the time wasn't the best. And I think another important person or group of people to think about who our outreach would be going to is parents, right? So parents, so even though it's youth that we're trying to have participate, the parents are the ones that are going to decide whether or not they go, usually, or give transportation or permission. And so, thinking about those parents, can it be advertised at the school or go home in the school newsletter, or some way that parents are getting that information from their students or from the school and having it be promoted that way. So maybe the kid doesn't want to go, but the parents is you're going, And
there was sorry, Geneva, there was a comment from Darlene in the chat box that did mention parents. We hadn't got to that yet, but just wanted to give her the credit for that. And then separately from that, I would also consider coaches in the area, because they have some influence over some of the youth there. But yeah, just ideas.
Yeah. Thanks, Darlene. Yeah, great. Is there something, does she write more or just parents?
No, just parents, but I just wanted to put that out.
Yeah, it's so important. So we think, we're just doing a youth program, but it's there's so many other decision makers or stakeholders involved. Coaches is a great thing. Oftentimes they have good relationships with the youth, or they're mentors to those youth. And so they can really encourage people to get on board. And so if you can get the coaches on board, maybe you can get more youth on board. And thinking about, what are the games that we're playing? Is it accessible for everybody? Is it super competitive, or is it more just teamwork based? So thinking about all those ways that you're approaching it and how that might invite or detract people from participating. And maybe a lot of people don't associate themselves with athletics or sports. And so is there a way to maybe change the language of your program to be a little bit more like a movement league, or something that feels a little bit more accessible to everybody that doesn't maybe feel like a strong sports athlete? So lots of different creative ways. Thanks. So we're going to do one more. So you work at a clinic, you're trying to recruit people in your community with diabetes or pre-diabetes to come to your diabetes prevention and self-management class. you're having a hard time getting participants to stay enrolled in the class. What are some ways you could address this?
We have one in the chat box that said incentives.
Yeah, make people feel like their time is valued, keep it fresh and exciting, you know, like especially as an adult, maybe you're not like stoked to go to like a educational class, or you feel like you graduated school already, you know, so making it fun and interesting. You know?
What about those programs that cannot write in incentives into their program?
I still think that maybe there's fun ways that you could do that. Maybe that means you could ask for some donations maybe from somebody else. Like if like, I know banks have to do sort of community engagement stuff, or you could get, you know, swag from another event or place like your county public health department, or yeah, seeking some donation of some way. Maybe there's somebody that yeah, make something, or you could like have like
I may have some assistance.
Yeah,
So that's
lay it out
where the like partnerships really come in, right? So if you're putting together something, like Geneva's been using the youth as an example. So if you're putting on something for your youth, then you don't have any room in your grant to do anything for the parents while they're waiting around for their kids to finish that activity. You could partner with some kind of local agency to have something for the parents while they're, you know, just waiting around for their kids.
Yeah.
There's another in the chat box. Set up a display in your waiting room or meet and greet with patients in the front lobby.
Nice. Yeah. So just getting excited about putting out some advertisements where those people might already be going, you know, so that they can see it and maybe their physician can recommend it. I was trying to think about, you know, creating something so on the incentives idea, you know, is there a way to have some incentive that isn't necessarily an item? You know, maybe it's like doing something like shout outs or recognition, or maybe doing like a spotlight where people feel like they're seen, or they get like highlighted with who they are and kind of the progress that they've made and get support from that group. So I think there's one big way to keep people coming back to groups is to build community, right? So if people feel stoked about that environment, they feel like they are connected to people there, they're supported, they're getting information, it's fun, they're more likely to kind of come back to that. And obviously if you can get, you know, give like little incentives, or maybe you have like a special treat, you know, every other week or something that, you know, people can look forward to, or somebody shares and creates something. You know, I think building that community and kind of building relationships, because then it becomes less about the diabetes education and more about like the community and the relationships that they're building with the people in the class.
Miss Geneva, we have a couple in the chat box. Provide healthy meals, make calls every week to patients to check in, or have participants call each other during the week, make up class so people don't feel behind, brainstorm solutions so they feel motivated. We have one more, reaching out to diabetics and families so they have the support, family as well, to achieve their wellness. And the last one is our healthy cooking sessions in our group is fun and they get a nice lunch.
Awesome. You guys must do this work. Yeah, those are fantastic. Those are fantastic responses. So all of those, you know, and I think also asking those participants of why are they coming or not coming? And then kind of going back to those ideas of location, transportation, content, you know, are all of those things giving them, like engaging them to a point where they want to come back? Nice. Okay, so we're going to keep moving on. So outreach communication, so there's a whole bunch of different ways to do this. So infographics, the ones listed here, I know that you can do free trials of, or you can do free versions of those. They're not as extensive. They don't offer you as much like photos or templates and that sort of thing, or you can pay for that. but those are pretty user-friendly ways to make a flyer, put some information, nutrition information or physical activity information onto something that people can read and engage with easily. Text message campaigns is great for reminders. So I just learned how to send automatic emails from Outlook so that I remind people for our webinars. And, that seems to actually help our attendance. So can you do that with text messages or email something? The word of mouth or in person is a great way. If people are stoked on something, they'll talk about it. And so getting those voices and community champions to talk about your program and stoke people out on it. And then obviously social media, the newsletters or mail outs, and then radio, TV, print. So lots of different ways to communicate, or things in an office. Okay, so we're gonna, I just wanna launch a poll really quick. I know we're getting close on time here. So there's a, let me figure out how to do this
While you're figuring that out, my dear, we also have, we send out a diabetes talking circle newsletter every month.
Nice. Yeah, so doing something every month where people can expect it, and you can include that with all of the information that they need, upcoming events, educational information. Okay, I'm going to do this polling, which is one question, and we'll also be doing our evaluation at the end, but which is coming shortly. So, which outreach methods have you found the most effective? Okay. What are our results? So it looks like word of mouth and email kind of came up for tide. So, and then print and newsletter. So just again, knowing your community, knowing what the responses are, what are people talking about, and then tailoring your messaging to that. Thanks. Okay. Okay, so, and this kind of goes up to you, but if anybody wants to type this in the chat, and maybe we can use this and share some of this out, but what has worked for you, what does not work for you, what gets you to show up to something? Ask yourself that question. And then does any of you have a real scenario, outreach scenario that you want help on, or that you're sort of struggling with, or maybe you want some feedback from the rest of the group on how to address some of those barriers?
I just have a quick comment to add to that as well, maybe another bullet point.
Mm-hmm.
I also come from a very small community, and one of my bullet points would be, are we targeting the folks that we need to be targeting? Many times the people that are coming to these events aren't always the people that we really need to come to these events. So how would you target? And are we targeting the not high needs population, but the people that we really, really want to get these education out to?
Yeah, I think that's a really important point, and I think sometimes in our communities, we have the same people showing up every time, maybe the family of the people that run the program, or the family of, who's in leadership or something. But some folks that really, need those services also aren't getting access to them. And I think that is a question that really relates to this whole presentation, is like, are we bringing those folks to the table to understand how we can meet those needs? Or are we bringing our services to those folks so that they can access them in a way, and making sure that we're really getting the people that don't get all of those services all of the time, spreading the love a little bit, Thanks, Julie. Okay. Well, feel free to type if you have anything you want to talk about or ask, and then also just know that these are questions that you can ask us as staff too. So, or, you can ask us and we can put it out to the larger grantee community. If you guys are all doing really similar work and probably have different similar challenges and successes, And so how can we sort of collaborate with each other and brainstorm, because sometimes it's, you know, you don't have all the answers. And then again, always the best answer is asking your community, you know, asking the actual people that it's impacting, or that you want to know the information from, or how to reach them, you know.
We have one more in the chat box, Ms. Geneva, from Cloverdale, sending reminders of the events, not just the actual event, but sending reminders maybe 2 weeks or 2 days before the event.
Yeah, that's huge. Because sometimes I will get an event, I'll be like, oh yeah, I'm super excited about that, but it's 3 weeks ahead of it, and then I just get in a rush and I totally forget, or it gets buried in my email, you know, or you didn't put it on the calendar or whatever, and maybe I had every intention of going, but I just forgot, you know. And so, like, yeah, that's a really easy thing that we can do to try to encourage participation and remind people and get them there, you know. And maybe it's like, hey, and I'm doing a carpool, we'll meet here at 6 o'clock and we'll take everyone out, you know. And, you know, how can we just help encourage people to get there with just simple reminders and removing a couple of those barriers. Okay, so that is actually all I have, which is kind of perfect timing. And if there's questions, I'm happy to stay on a little longer and ask those. But I'm going to launch the evaluation poll. So those of you that do have somewhere else to be can move on. But thank you for your participation and your time. And feel free, if you have any questions or comments or needs, let us know.